Hello, welcome back to English for Nursing. In this session, we're going to learn about handling angry patients or handling complaints. Basically, when people are sick, they tend to be oversensitive, and even small things could make them feel sad or upset. So things in a hospital such as slow response, pain, late meals, blocked IV line, dirty linen, and room which is too hot or too cold could trigger complaints. As a nurse, you need to remember that in this time, what they feel is pain. And therefore, what you need to do is to be there and to provide support to them. And my first questions in this session is, how would you like to respond in angry patients who have been pressing the bell many times while you are very busy serving other patients? Are you going to be very angry and explode? Well, of course you're not, right? Replying to patients' anger does not align with the therapeutic communication that a nurse should apply. Instead, when dealing with angry patients, we need to calm them down using a strategy. We call it calm strategy. Calm stands for C, A, L, and also M. C stands for calm, which means calm down. So when the patients are angry, pressing the bell many times, then you come and they curse you with words you really don't like, what should you do? You need to calm down. So you should not take things personally because basically you're not being angered by the patients. They're not angry to you. They get angry to their situation, why they are being treated in the hospital, and they are angry about the disease in them. So remember, when they are angry, you should not reply to them, but you need to calm down. Second, A stands for apologize. After you calm yourself down, you need to apologize patients for the things that makes your patients uncomfortable. You could also explain you cannot be there anytime sooner. So basically, you can say like, I'm sorry, Mr. or Miss. I've just returned to the nurse stations after an emergency call to help the patients in emergency room. So you basically apologizing and you tell the reasons why you cannot be there sooner. Next is for L, which stands for learned. In this part, you must look and listen actively to identify and learn the root of the problem of why is your patient complaining. Remember, you should not be interrupting. This part is a very crucial part because this is the time that they are about to spill out why they are complaining. So many times, this is not about the pain alone, but probably they are afraid to be in hospital or they just need someone to listen to them. By carefully listening to your patients when they are complaining, you'll be better learning about what support you to provide after they are complaining. The last is make an over. After listening to the complete complaint, it's time to offer solution to complete the problem. Remember that the offer has to meet the patient's needs, and you need to do it sincerely. So the example of the expression could be like, I'm sorry, I cannot get here earlier. Or, what is the level of your pain right now? From 0 to 10. And after the patient is responding to you, you could convey your empathy and what's the solution that you could offer. And to say this, you can say, I'm sorry that your pain is really high. I would let the doctor know, so we will see if he can prescribe something to reduce your pain. Or if we can get your medication earlier, I will make sure that the doctor knows that your pain is really high. Alright, so that's the calm strategy to handle patients' complaints. Now it's our time to read the model dialogue. And when you are reading the dialogue, please do analyze which part is the C and which part is the A, which part is the L, and also which part stands for the M of the strategy. Let's read it together. Alright, so after reading the dialogue, can you see how the nurse used the expression? She uses the calm strategy as a part of therapeutic communication in which she affirms support and advocates the patients. So now we come to the end of the section, and to wrap up, let's review what calm strategy is. C is for calm, that is not to take things personally. A is for apologize, that is the reason of why you cannot be there sooner. L is for learn, in which you look and listen to the complaints of the patients. M is make an over, that is you over the solution. Okay, so we have finished learning for today. Remember to use calm strategy whenever you find the patients angry. Goodbye and see you on the next meeting.